management, specific management, if swelling is present, diuretics should be given. Loop diuretics is the choice of drug, not the thiazide diuretics. AC and ARB group is the first choice. Calcium channel blocker is the second choice, vasodilator, then beta blocker. High protein diet should be given to nephrotic syndrome. Salt restriction is always given. And steroid is the hallmark for treatment. Other drugs are cyclophosphamide, clombuzil, cyclosporin, tacrolimus, mycophenolate mofetil, and rituximab. Childhood nephritis can be cured in 80% cases by steroid. 30% adult nephritis is automatically cured by conservative treatment. 50% nephritis cured by specific treatment. 25% nephritis do not cure by using any drug. They go into end-stage kidney failure. You know today about the PKD tolvaptan, which is on treatment for 3 years with placebo. The COX, CCX16, another target for the IgA nephropathy, hemolytic uremic syndrome, and other drugs. And CCR2 is for peripheral decreased urinary albumin, type 2 diabetes. These are on trial. How we know our kidney is failing? It is very difficult. 70 to 80% have no symptom. Only serum creatinine is the hallmark and GFR. So periodic measurement of serum creatinine is essential. How to treat anemia, how to control calcium phosphate and parathyroid hormone, hyperlipidemia, modification of diet, changes of lifestyle. You hear in this CME program, I do omit this, but be careful when in every patient, goal of hemoglobin is 11 to 12 gram. But please, please and please, do not give subcutaneous erythropoietin without checking iron. When patient comes, doctor immediately gives subcutaneous injection without looking at the iron and ferritin level. That is the misuse of drugs. And that misuse should be considered by every doctor. And the general pharmaceuticals is all doctors how to increase their cell for erythropoietin. But you, in your conscious level, see whether erythropoietin is at all necessary. If necessary, should I check serum iron and ferritin and then prescribe? Otherwise, please do not consider erythropoietin before seeing the level of serum iron and serum ferritin level. Control of calcium phosphate and PTAs, you have heard from Professor Muhibur Rahman this morning. So that is another controversial part because we have no specific dietitian or renal dietitian in our country, and it gives a lot of controversial aspect. That is the problem in Bangladesh. When a patient goes to the dietitian, he restricts everything. And as a result, patient comes to us and pray for us. What drugs, what medicine, what diet should I die or restrict everything? They restrict everything for the patient. Do not consider their phosphate level, they do not consider the potassium level, and they do not consider uric acid level. They restrict everything for the patient. But this is not easy to be a renal dietitian. So culture of calcium, phosphate and PTAs, your diet phosphate intake 0.8 to 1 gram per day. may need phosphate binder with males, 25 OH D3 PTH as you can see, but our patient, 80% of Bangladeshi population has vitamin D deficient. Normal people, whether a doctor or non-doctor, 80% people has got vitamin D insufficiency. Very important nowadays, but still because the patient wanted protein restriction, you cannot restrict protein more than 0.6 gram per kg body weight. When GFR is 25 to 55 ml, 0.6 gram per kg body weight, and this more than 50% calculated protein should be high biological value, that is first class protein. Meat, egg, fish and milk. 50% is second class, pulses. But dietitian believes that pulses is a poison. Change of lifestyle. Dietary salt intake must be restricted or modified. When kidney fails, what should I do? We should consult your doctor. When GFR is 15, doctor will tell whether you go for hemodialysis, CAPD, or kidney transplant, whether a live-related or deceased transplant. These are the patient long-time hemodialysis. This is insertion of CAPD by a nephrologist. This is CAPD patient at home. And if kidney donate, then you can survive. This is parents to sibling, sibling to sibling, and the transplantation patient. A dialysis patient can survive 5 to 10 years of life if there is no heart disease. And transplantation can survive for 10 to 20 years if younger than 40 years. No non-diabetic patients survive more than a diabetic patient. Primary prevention screening is the only hope. Primary care providers can play a significant role. Emphasis should be detected on CKD, managing it prior referral to improve outcome. So, suggested plan, screen CKD at community health clinic, which is 16,500 community clinic. Identify CKD at Upazila Health Complex. Use two simple tests needed to diagnose chronic kidney disease. One is serum creatinine, eGFR, ACR and PCR. Correctly identify CKD by stage in district hospital or medical college and give appropriate treatment. Patient with glomerulonephritis, diabetic nephropathy, hypertension, CVT or systemic diseases, who should be screened? Patient at any age, but at the Bangladesh it should be above 40. Patient with family history of CKD, patient exposure to drugs and toxin. What you should screen: age of the patient, sex, height, weight, BMI, check blood pressure, measure blood sugar by glucometer, check urine for albumin by albustix, by Neal test 1 plus 2 plus 3 plus. If one of these positive, refer to Upazila Health Complex. Recheck blood pressure, blood sugar, urine, check microalbumin, measure serum creatinine. If this is positive, then refer to a nephrologist. When to refer nephrologist? When there is abrupt sustained fall in GFR, GFR less than 45, significant albuminuria, rapid progression of CKD, persistent urine RBC, CKD and hypertension, refractory to persistent abnormalities of urine protein. What can you do as a nephrologist? Recognize and test at risk patient, educate patient about CKD and treatment, manage nephritis, hypertension, diabetes according to your guideline, address with CVT risk factors, monitor eGFR, ACR. What can nephrologists do? Evaluate and manage anemia, malnutrition, CKD, MBD, other complication is at risk patient. Refer to a dietitian for nutritional guideline. Consider patient safety issues on CKD. The patient decline of renal function is the baseline, but if he get painkiller, if he had infection on nephrotoxic drugs, antibiotic dosing, then it suddenly decline. Further decline occur, use of contrast, and then goes to end-stage disease 5 years before. And this is because of doctor's prescription. So plan to prevent CKD, identify hypertension, diabetes, CKD, CVD, and NSID. Primary care physician, diagnose kidney classification, physician at CKD problem list. Treatment start AC and ARB, follow up for protocol to goal, and control blood sugar in diabetes. Cost involved, taka 452 for screening, only 500 taka. Strategies for prevention of kidney disease in emerging countries, last slide. Public health has a lot to do. Improve nutrition, water and sanitation, dietary salt reduction, go for exercise, cessation of smoking, infection control, improve maternal health. This has to be done by the government. What a doctor can do, protein reduction, blood pressure control, glycemic control, lipid control, modifiers, new technology, cost effective may be the procedure. So if government does not come forward, it is impossible to prevent CKD. So keep yourself fit and active, eat healthy and keep weight check. Stay hydrated, don't make the patient dehydrated. Avoid smoking. Rational use of antibiotic, please. No NSID. Check kidney function regularly after the age of 40. However, RRT is an expensive therapy accounting for increased healthcare spending in high-income countries. Some 75% people who live in low and middle-income countries where untreated ESRD is enormously high. Economic factors are the most important issues for management of patients with kidney disease. Proper follow-up of CKD and their management are very important. Small number of nephrologists, lack of patient education are also important for control of chronic kidney disease. More emphasis is needed for prevention of CKD than treatment of ESRD. Involved or cooperation of philanthropists, community, government will be required at local, state, and national level. And thank you very much. We must measure both to hold leaders accountable, and universal health coverage is not possible until and unless people can get the health services they need without fear of financial hardship. Thank you very much.
Thank you very much, sir, for your informative and excellent deliberation. You are always a guide and inspiration to all nephrologists of Bangladesh.
Now, I would like to request Professor Dr. Pradeep Kumar Datta, sir, President of Bangladesh Renal Association, Chattogram branch, Professor Dr. A.M.M. Ehtishamul Haq, sir, Vice President, Bangladesh Renal Association, Chattogram branch, and Dr. Mohammad Nurul Huda, sir, General Secretary, Bangladesh Renal Association, Chattogram branch, to take the chairs with our honorable special guests and chief guests.
Our today's special guests are newly elected General Secretary, Bangladesh Renal Association, Dr. KBM Hadiujaman sir, General Secretary, Bangladesh Renal Association, Dr. Mohammad Nazrul Islam sir, Honorable Professor Dr. Masum Habib sir, Vice Chancellor, Rajshahi Medical University, Honorable Professor Dr. Moshad Ahmed Chaudhary sir, Vice Chancellor, Sylhet Medical University, Honorable Professor Dr. Mohammad Ismail Khan sir, Vice Chancellor, Chattogram Medical University. And our chief guest is Professor Dr. Konok Kanti Borua sir, Honorable Vice Chancellor, Bangabandhu Sheikh Mujib Medical University. We are with extreme sad heart announcing that due to some unavoidable circumstances, our two guests are absent today. Dr. Mohammad Ismail Khan sir is now in Malaysia, and Vice Chancellor, Rajshahi Medical University, Professor Masum Habib sir is busy with a schedule with Honorable Prime Minister, so we are with absence of them. Now, I would like to request our Honorable Speaker, Professor Dr. Harun Rashid sir, to come over the dais.
I'd like to thank again our today's speaker, Professor Dr. Harun Rashid sir, for his time and valuable contribution. Now, I'd like to request the Honorable Chief Guest, Professor Dr. Konokanti Borua sir, to kindly hand over the crest to our speaker, Professor Dr. Harun Rashid sir, as a memento from us.
Now, I would request the newly elected General Secretary Bangladesh Renal Association, Dr. KBM Hadiujaman sir, to say something for us.
Assalamu alaikum. I am Dr. KBM Hadiujaman, newly elected Secretary General of Bangladesh Renal Association. I am delighted and wonderful this evening in front of this learned audience. I want to thank to the Renal Association of Chattogram branch and distinguished chairman of this learned session, Professor Konokanti Borua, Vice Chancellor of Bangabandhu Sheikh Mujib Medical University, Professor Harun Rashid, my teacher, Professor Mushed Ali Chaudhuri, VC of Sylhet University Medical College, and Professor Ehteshamul Haq and Professor Pradip Datta, who organized the program very nicely. And I am grateful and thankful to them as I am here as special guest to say something in front of you. And as I am here as newly elected Secretary General of Bangladesh Renal Association, I want to say something regarding our junior nephrologists, those who are here in this wonderful session. As the achievements of our professor, delighted teacher, those who have taught us very nicely, they have dedicated their life for us. We have to remember their contribution to the nation. If we are going to forget their contribution, dedication, I think we are going to lose our these mentalities. As we are daily practicing with our patients, we have lost our morality. I think these inspirational and motivational speeches, I have to say something in this learned audience. Even though it's not that much nicely hearing, I don't want to give you the lesson, but something it is mandatory, I think, to say. As I have been elected the Secretary General of Bangladesh Renal Association, I think I have to say something. If we are not going to take the action, if we are not say something regarding our activities, as we are practicing in our daily practice, I think it is mandatory. If we are not committed to our patient, those who are kidney patients, they are very poor. They are coming abroad from different districts, rural areas to us. So we have to be very kindful to them. If we are not thinking about their financial condition, if we are not thinking about their social status, then it is very harmful, it is very painful for us. So I think one thing I want to mention that regarding my professor Harun Rashid, he told us that if you are going to prescribe some sorts of erythropoietin, like when you will see this patient is deficient of hemoglobin, iron deficiency, you have to classify the patient whether he needs erythropoietin or whether he needs iron supplementation. First of all, you have to decide. I think some of our physicians, what they are doing actually in our daily practice, everything is normal. His or her hemoglobin level is more than 13. His renal function is normal. In spite of these things, what we are doing, we are calculating about their GFR. We are showing them, you see, your GFR is less than 90. So you are a patient of kidney disease. So we need to give you the injection erythropoietin. In first prescription, what I see, he has given like Eposis, one brand name. In next visit, he has prescribed like Iprex. In next visit, he has given Darvatin. It is my question to the learned audience. Is it at all fair? Should it be the prescription form? Is it our commitment to the nation or patients, those who are coming from rural areas to us? This should not be. We have to say something. We have to go. We cannot earn that much. We cannot be a person like Professor Harun Rashid. We cannot be like Professor Nurul Islam sir. But to some extent we can go. But what's the use of these things? So we have to change. My earnest request to our junior colleagues and my friends, please don't do those things. What our seniors teaches us, what they have told us, please practice according to their advice. It is our morality, it is our daily practice to see the condition of the patient. Kidney patients are poor. So we have to keep in our mind, this is regarding our daily practice and our mentality. One thing more I want to say regarding the university. We are from Bangabandhu Sheikh Mujib Medical University, and it is my request, as I have got chance, my BC is here, I want to request my BC Professor Konakanti Bodua, and he has to increase the number of posts and the positions in Bangabandhu Sheikh Mujib University in the Department of Nephrology, as we can give chances to the doctors from all the country. And in the University of the Chattogram Medical College, what about the condition of the nephrology department? I don't know. As we have given them chance to increase the number of nephrologists in their department, it will be helpful for the people of the Chattogram. And also, those who are practicing in Sylhet Medical University is also there. There should be a very good department of nephrology. So my request to the VC of the Sylhet Medical University, sir, you please raise your voice to increase the number of nephrologists in Sylhet. So finally, I want to say, as the session is already been linked, so I want to conclude my session that it's my apology to my teachers. You please help me in my next tenure, if I can continue my practice, if I can teach my colleagues, if I can say my colleagues, if I can raise their voice against the malpractice, against what we are doing, and we want to be very clean-cut nephrologist. We don't want to practice in such a way the patients will not save from our hands. So in this wonderful evening, I want to give thanks to my teacher, Professor Konakanti Bodua, and to my Professor Harun Rashid, and moreover, I want to give thanks to Professor Dr. Pradeep Datta, who arranged this wonderful evening, and to my beloved younger brother, Dr. Nurul Huda, Secretary General of Chattogram Renal Association, and to Dr. Mahatab. He also worked a lot for us, entertaining us very nicely. We are very thankful to them, and it's my lesson to them. We are also inviting to them, if they need any sorts of help from us, from the Central Association, we have extended our hand. We are extending our hand to help them in all aspects. Thank you very much. Thank you once again. Assalamu alaikum.
At first, I want to congratulate sir on behalf of my institute, that is Bangladesh Renal Association Chattogram branch, for being newly elected General Secretary of Bangladesh Renal Association. And thanks sir for your valuable speech and so inspiring words. Now I would like to request Dr. Nurul Islam sir, General Secretary Bangladesh Renal Association, to say something about us.
Thank you. Assalamu alaikum and very good evening. Respected Chairperson of First International CME 2019, Professor Dr. Pradeep Kumar Datta, Bangladesh Renal Association, Chattogram branch, and respected Chief Guest, Professor Dr. Konakanti Bodua, Vice Chancellor, Bangabandhu Sheikh Mujib Medical University, and Vice Chancellor, Professor Dr. Morshed Ahmed Chowdhury, Sylhet Medical University, and my dear respected teacher, Professor Dr. Haruna Rashid, Chairman, Kidney Foundation, Bangladesh, and my dear friend, newly elected General Secretary of Bangladesh Renal Association, Dr. KBM Hadiuzzaman, and Vice President, Bangladesh Renal Association, Chattogram Branch, Professor AMM Ehteshamul Haq, and my dear younger brother, Dr. Nurul Huda, the Secretary General, Bangladesh Renal Association, Chattogram Branch, and my dear delegates, home and abroad, and good evening. Bangladesh Renal Association basically has formed 1977, and after that, every year, even alternate year also, they are arranging this national and international CME. And by this, we are enriching ourselves by knowledge, and by that we can treat the patient very perfectly. Bangladesh Renal Association, Chattogram Branch, has formed 2017. And within these 2 years, they have already organized a national CME and followed by international CME. I feel honored they have asked me, especially Professor Pradip Kumar Datta and his team, what had done, and this is tremendous job. I can take it. I think for my friend Dr. KBM Hadiuzzaman, his challenge is waiting for him. Such a program, when he will arrange, I think he can do more than that. But again, I am congratulating Chattogram Branch, Bangladesh Renal Association. And this inauguration ceremony scientific seminar, already my dear respected teacher, Professor Haruna Rashid, has explained everything about the chronic kidney disease, acute kidney injury, even the picture of our country personnel regarding who are attending to as a nephrologist and nephrology. But I like to add with him, what about the government? Next project. I'm informing dear audience, within the coming 2 weeks, our government medical college, I think around 36 medical colleges at present, and 64 district, within 2 weeks, their DPP, Developmental Program Project, is coming in the ECNEC. And they will establish 50-bedded government medical college dialysis unit and 10-bedded district hospital dialysis unit with manpower. Not only this, even 8 divisional town except Dhaka, 7 divisional town, there is developing a 12-restored hospital that included pediatric cardiology, cancer or malignancy, and nephrology and burn unit. And this 12-restored building, 3 floors will be for the only nephrology, and that will be 50-bedded dialysis unit also. Among these medical colleges, 14 medical colleges that should be supplied with at present or existing support, existing instrument, that will be supplied another 25 or 50 machines for dialysis, and we have manpower also. But remaining 17 medical colleges, that will be supplied partially at present. That primarily they will establish 25-bedded hospital. But district hospital already selected 30 district hospital. They have selected for 10-bedded dialysis unit with manpower. I hope within the coming 2 weeks that will pass in the ECNEC, and I think we can go for treatment, even we can go for all sorts of help to our people. And at the end of this, I like to thank again this Professor Pradip Kumar Datta sir and his team to arranging such a tremendous program. Thank you very much. Thank you. Assalamu alaikum.
Thank you, sir, for your valuable speech. Now I want to call upon the Honorable Vice Chancellor of Sylhet Medical University, Professor Dr. Morshid Ahmed Chaudhry, sir, who is also a member of Academic Council, Bangabandhu Sheikh Mujib Medical University, President of Obstetrics and Gynecological Society, Sylhet, to share his thoughts with our respected presence of today. Sir.
Thank you, the moderator. Mr. Chairperson of the session, Professor Pradip Kumar Datta, President of Renal Association Chattogram branch, Honorable Chief Guest, Professor Konok Kanti Bodua, respected Vice Chancellor, Bangabandhu Sheikh Mujib Medical University, our renowned nephrologist and pioneer of the kidney disease physician, Professor Harun Rashid, General Secretary of Renal Association, Bangladesh, and the General Secretary of Renal Association, Chattogram branch, the other dignitaries in the dais, respected teachers, my dear fellow nephrologists, urologists, my dear doctors, dear participants, ladies and gentlemen, Assalamu alaikum, good morning, good evening. It is my pride privilege to have this opportunity to be special guest here and to say a few words before these august gatherings. And I must give thanks to the President of Renal Association of Chattogram branch, Professor Pradip Kumar Datta, to give me this opportunity. As he invited me and rang several times to come to Chattogram from Sylhet. That's why to Dhaka and then Dhaka to Chattogram this evening. And I am very much delighted that I am here with the national and international delegates and international medical professors here. And so I am very much enlightened here, again I say. Kidney. In our body, we have few vital organs, starting from brain and probably up to kidney. And brain is one, next heart is one, lung is two, liver is one, again kidney is two in number in our body. But unfortunate enough that when the disease started, especially the chronic kidney diseases, it affected both the kidneys. And that's why we have to die, person have to die within few years. If one kidney became affected and another kidney is spared, as for example, if we have cataract in one eye, just after operation, or if one eye damaged, then we can see by another eye. So, like that, if one kidney is spared from that disease, that is the chronic kidney diseases, then the patient most probably survive life as their life gifted by or allotted by the Almighty. But it is unfortunate. And nowadays the kidney disease became epidemic in our country because of epidemicity of diabetes mellitus and blood hypertension. But I am very much hopeless in that condition that our nephrologists cannot have one drug that stops the progress of disease.
without involving, without managing or moderate managing of the management of the diabetes and blood pressure. They always say that you control your diabetes, you control your blood pressure, you lose your weight, then the progression will be prolonged or progression will be slow. But it is indirect management, I think. I am very much enthusiastic that within few years probably our fellow researcher of the world, who are research about the kidney diseases, they invent one single drug that stops the progress of chronic kidney diseases, even in diabetes and with diabetes and hypertension. If all the problem, all the management done by the patient, then what we will do? We doctors, what we should do? রাত্রে একবার রুটি খাইবা, সকালে একটাবার রুটি খাইবা, 1 ঘন্টা হাঁটবা, চিনি খাইবা না, তারপর ওয়েট বাড়াইতে পারবা না। তো কেমনে হবে এটা? আমি এটা বলতে চাই যে এত রেগুলার লাইফ মেনটেন করা, ইট ইজ ভেরি ডিফিকাল্ট, and especially very difficult for the physician mainly, and also for the surgeons and obstetricians. I am an obstetrician. Very difficult to maintain this regular lifestyle throughout the life to control the diabetes. So in case of diabetes, অনেক লোক আছে তার পকেটে 1000 কোটি টাকা, কিন্তু তার ডাক্তার বলবে তুমি খাইবা রাত্রে রুটি একটা আর সকালে একটা। তো তার কি এই টাকায় কি লাভ হলো? So diabetes, to control the diabetes or to cure the diabetes, research should be more and more. I think we are a bit lagging behind in research sector throughout the world even. I am a diabetic patient for last 26 years. I became diabetic at the age of 32 and I suffer. 3 times I have to push needle in my skin and subcutaneous tissue. So is it very joyful or painful? Definitely it is painful to push 3 times, 4 times the insulin needle. I have to do. So I am actually the victim. I know how pain is at as much as that peak. So the time is coming to replace the pancreas, to replace the islet of Langerhans beta cells from the pancreas, genetic transformation, stem cell therapy for the cure of diabetes, and also somewhat to cure the hypertension, not to control. Till date, even in the world, researcher cannot invent simple capsule of insulin without injection to take capsule or spray of insulin to control the diabetes, because it is protein. But why not? Maybe it is protein, but it should be invented, capsules or tablet form. That's why the patient should not take the pre-current or injection. Professor Harun Rashid, Honorable Professor of Nephrology, I say, he is I think the senior most professor of nephrology in Bangladesh nowadays. He narrated about the kidney diseases, blood pressure, diabetes, and hypertension and diabetes, starting from primary up to the tertiary level. Its prevention, its management, its complication, its fate, until transplant. But in our country, I think, by last 10 years, the revolutionary change occurs in the health sector of Bangladesh and it is the emerging tiger in the Southeast Asia. And it is recognized by the World Health Organization, United Nations, and by that they awarded the Bangladesh from that United Nations and World Health Organization, and our Honorable Prime Minister received that award in favor of the country because of our decreasing maternal mortality, infant mortality. And all the parameters of the health sectors are improving in our country, starting from primary level to tertiary level. Ban Ki-moon is coming to came to our country last few years back. He goes to Kulauda Upazila of Maulibajar district and visit a community clinic. He told that the countries, different countries of the world should take the example of this community clinic of Bangladesh in their countries to develop the health sector. So you see how much we progress. In the year 2000, for my angiogram, we have to go to India, that is in Calcutta. But nowadays, angiogram, angioplasty is doing in the district level also. At Sylhet, 3 institutions are there. Sylhet Medical College, M.A. Usman Medical College, Heart Foundation, and the Northeast Medical College, angiogram, angioplasty is doing randomly. All the treatment of cardiac diseases, all operations, open heart surgery also, valvoplasty, valve replacement, etc. Endoscopic valve replacement started in our country. No patient needed to go to India for the treatment of heart diseases. No patient have to go to India for the treatment of, that is, kidney diseases. Our many surgeons were there in Bangladesh. They did very efficiently kidney transplant. But because of some agency of neighboring countries and with the journalists for their bad propaganda of kidneyless villages, for this headline, the surgeons became afraid of to do the transplant surgery because of Mamla Mokodoma. But they can do. Now the patient should go to India for their transplant. In Bangladesh, it spent 2 lakh, 1.5 lakh to 2 lakh. But in India, it spent 30 lakh. In Singapore, it spent 50 lakh, near crore. So, we people should realize that we doctors are moving very fast. Actually, the mid-level doctors, they train themselves by their own costing from the different countries of the world. They do the endoscopic surgery, laparoscopic surgery, endoscopic urosurgery, laparoscopic, all the surgeries, and PCNL, etc. Everything in surgery department. They are endoscopic neurosurgery also. Our professor of neurosurgery is here. Legend of neurosurgery is here. He is doing very efficiently all the neurosurgery in Bangladesh. But why we should go to India? Because of bad propaganda from the journalists. Because of the propaganda from the different agencies of the neighboring countries to shift the people from this country to the neighboring countries and to drain our foreign currency. So it should not be. We should have to realize and we should have to be cautious about our treatment. Actually, the doctors are more efficient, more and more efficient. They are going to be much efficient very rapidly in our country to manage all these cases, except few cancer surgeries and except the heart transplant, liver transplant, etc. Liver also liver transplant is done very few cases, but heart transplant till date in our country is not possible. So, lastly, I should say we should be more research oriented and prevention oriented. Prevention is the main factor to decrease the death rate from kidney diseases. And another one is the latest technology to another one for the kidney diseases, the random transplant surgery in our country. Only the family member should donate the first degree relation donate the kidneys. But with one kidney, a man can survive. If a man can survive by one kidney, in that case, if he donate the kidney to the other person for his survival, so why there is objection? So it should be make a law in the parliament to take kidneys from the brain death patient from ICU to eyes, liver, and etc. This law should be made by the parliament very within short time. By that, we can do the random transplant surgery, that is transplant of kidney here in Bangladesh. Lastly, I should say, we are much ahead. We are growing very fast in the health sector, also all the sectors. By last 10 years, in the teaching sector, in the Podda Bridge and others, from submarine to the satellite, we are running. We are Bengali people, Bangladeshi people, we are running. So, you see, we should give support to this government and come forward from every sector to development, to continue this development till to the end. Dear doctors, this is the month of March, month of our independence. We should pay our highest gratitude to the liberation war martyrs today in the 2nd March of 2019. For their life, we are independent now. We are professor now, we are doctor now, we are the principal, vice chancellor now for their life. And finally, the founder of this country, our father of nation, we should pay our highest gratitude to him, our father of the nation, Bangabandhu Sheikh Mujibur Rahman. Finally, pray for you. Long live everybody, and pray for me also, and pray for the guests seated in the dais here. With this few words, I conclude my speech. Thank you very much. Thank you all.
Thank you, sir, for your valuable speech. We are very much honored that you came here in this August session. Dear gathering, now it's time for speech by our honorable chief guest, Professor Dr. Konok Borua sir, Vice Chancellor of Bangabandhu Sheikh Mujib Medical University. He is the President of Bangladesh College of Physicians and Surgeons and President of Bangladesh Society of Neurosurgeons and Bangladesh Association of Sports Medicine. I would like to request sir to come over the dais.
Society of Neurosurgery President Naya. Mr. President of this inaugural session, inaugural session of first international CME program organized by Bangladesh Renal Association, Chattogram branch, Professor Pradip Dotto, sitting in the dais, a special guest, Professor Dr. Morshed Ahmed Chaudhary, Honorable Vice Chancellor of Sylhet Medical University, sitting in the dais, our legendary nephrologist, teachers of many teachers, teacher of many teachers, Professor Dr. Haruna Rashid sir. He was the ex-chairman of Nephrology Department, Bangabandhu Sheikh Mujib Medical University. And sitting in the dais,
present Secretary General, Dr. Mohammad Nurul Huda, future Secretary General, Dr. KBM Hadiuzzaman, and past Secretary General, Dr. Mohammad Nazrul Islam, and also Vice President, Dr. A.M. Etashmul Haq, sitting in front, the dignitaries, renowned nephrologists of the country, and participants, foreign faculties, ladies, very good evening to you all. It is my pleasure to be present in this August gathering. You know, as my home district is Chittagong, I am from Mirasharai. Whenever I get any kind of invitation from Chittagong, I rush to Chittagong. Whatever schedule is in Dhaka, but I have to accommodate Chittagong's program with my program in Dhaka city. So today was a very, very important for my university in Dhaka. There was a induction program of the resident batch 10 today. And I have completed the program, and then I have to rush to airport and have to come here. So you can understand what kind of feelings I have for Chittagong. As from Professor Harunur Rashid's presentation, we have already been informed regarding the status of kidney diseases in Bangladesh, and that Sir has given all kinds of regarding treatment purpose and as well as to combat and to fight the kidney diseases. How we can combat this problem. As I'm a neurosurgeon, I will not go to the kidney diseases. I will, as a policy maker, as a vice chancellor, I will advise you one thing, and 140 urologists. So for 170 million population, the number is very, very small. So we must increase the number of nephrologists. And government also has taken some initiatives. You have from the speech of Dr. Nazrul, the past Secretary General of Bangladesh Renal Association, that government has already taken some initiative, and ACNEC already have passed that. In medical colleges, they are going to establish a dialysis unit, 50-bedded dialysis unit in medical colleges, and also in district hospitals also 10-bedded dialysis unit. So government is coming forward, but we have to provide the manpower. So how we can provide the manpower? Then I will request the executive committee members, the leader of the association, facilities by creation of post or something like that, so that we can, after providing the facilities, so then we can establish those units and we can run the units. Otherwise, it will not be proper for us as well as for the government to establish those units. So I am very much enthusiastic if you people come forward and we will make a policy, but we should not compromise the standard of our nephrologists. So without compromising, definitely we will increase residency program in many medical colleges, or you can introduce, we have sufficient facilities, we can introduce the course in different medical colleges. We are already late, I think. I will not continue more. I am very much grateful to the organizers for inviting me to come here, and I am extending my heartfelt thanks and gratitude to the foreign faculties for taking travels to come to Bangladesh and for exchange of views and their experience with our Bangladeshi nephrologists. And as you have heard, this is the month of March, the month of independence, and I am paying my respect to the father of the nation, Bangabandhu Sheikh Mujibur Rahman, and at the same time 3 million martyrs who have given their lives for the cause of Bangladesh. And I am extending my heartfelt thanks and gratitude to you all, the organizers, for organizing a wonderful scientific session. Thank you all.
Thank you very much, sir, for your encouraging words. Now it is the session for crest giving. Now I would like to request Dr. Soed Mahatabul Islam, sir, Organizing Secretary, Bangladesh Renal Association, to present the crest to our special guest, Dr. KBM Hadiujaman, sir.
Now I would request Dr. Faizur Rahman, Assistant Secretary, Bangladesh Renal Association, Chattogram, to give the crest to Dr. Mohammad Nazrul Islam, sir.
Now, may I request Dr. Rafiqul Hassan, Executive Member, Bangladesh Renal Association, Chattogram Branch, to kindly present the crest to our Honorable Vice Chancellor of Sylhet Medical University, Professor Dr. Murshid Ahmed Choudhury, sir. Now, our Honorable Chief Guest will be awarded by General Secretary, Bangladesh Renal Association, Chattogram Branch, Dr. Nurul Huda, sir, Vice President, Professor Dr. M.M. Ehtashamul Haq, sir, and President, Professor Dr. Pradip Kumar Datta, sir.
Now, time for crest giving to those persons who acted their best for organizing such auspicious ceremony. I humbly request Dr. KBM Hadiujaman, sir, to hand over the crest to Central Organizing Secretary, Bangladesh Renal Association, Chattogram Division, Dr. Soed Mahatabul Islam, sir.
Now I would like to request Dr. Ratan Kanti Saha, Executive Member, Bangladesh Renal Association, Chattogram Branch, to receive his crest from our Chief Guest, Professor Dr. Konok Kanti Borua, sir.
Now, I'd like to request Professor Dr. Murshid Ahmed Choudhury, sir, to give the crest to our Dr. Biplab Kumar Borua Dada, Executive Member, Bangladesh Renal Association, Chattogram, and Dr. Abdul Kader Bhai, Executive Member, Bangladesh Renal Association, Chattogram Branch.
it's time for giving the crest to the three moderator. First, the Satyajit Roy, the Dr. Hadiuzzaman sir will give the crest to Satyajit Roy. Dr. Satyajit Roy. And next, Dr. Merina Anjuband. Dr. Nozul Islam sir will give crest to Merina Arjumant and Farhana. And Dr. Nozul Islam sir will give crest to Dr. Farhana.
Dear audience, now it is the time to propose the vote of thanks. For this, I kindly request Professor Dr. A.M.M. Ehtashamul Haq sir, Vice President, Bangladesh Renal Association, Chattogram branch, to propose the vote of thanks.
Respected Chairperson of this session, Professor Dr. Pradip Kumar Datto, President, Bangladesh Renal Association, Chattogram branch, Honorable Chief Guest of the inaugural session, Professor Konakanti Borua, Honorable Vice Chancellor, Bangabandhu Sheikh Mujib Medical University, Special Guest, Professor Dr. Murshid Ahmad Chaudhry, Honorable Vice Chancellor, Sylhet Medical University, Honorable Inauguration Speaker, Professor Dr. Harun Rashid, Guardian, Father of Nephrologist of Bangladesh, Director Bangladesh Kidney Foundation, and Co-Chair, South Asian Region of International Society of Nephrology, Dr. Muhammad Nazrul Islam, Secretary Bangladesh Renal Association, Dr. KBM Hadiuzzaman, new elected Secretary Bangladesh Renal Association, senior professors, nephrologists from home and abroad, speakers, chairpersons, and ladies and gentlemen, Assalamu alaikum, good afternoon. I must thank all of you for attending, participating to this session of first International CME organized by Bangladesh Renal Association, Chattogram branch. We are very much grateful to Bangladesh Renal Association for endorsing the CME and all necessary support. I must thank Professor Konakanti Borua, Honorable Vice Chancellor of Bangabandhu Sheikh Mujib Medical University, to make time to be present and encourage us in the scientific program. We are also grateful to the special guests for their gracious presence and to inspire the nephrology community of the Chattogram. Eminent nephrologists from home and abroad and different countries are attending the conference in spite of their busy schedule. I must thank Dr. Pradip Chakraborty, Dr. Mohan B.A. and Professor Shankar Sundaran of India and Professor Shahriar Amin from United States of America for their gracious presence. We are ever grateful to them. Finally, I must thank industrial sponsors, electronic print media, media partners GTV, Daily Purbakun, as their generous support make this program successful. সম্মানিত সুধীমণ্ডলী, আপনারা অনেক কষ্ট করে আমাদের এই প্রোগ্রামে এসেছেন। আপনাদের সকলকে আবারও অনেক অনেক ধন্যবাদ জানিয়ে এখানে শেষ করছি।
Thank you, Professor Dr. A.M.M. Etashamul Haq, sir. Now we have come to the end of today's session. At this moment, I would like to request our Honorable President of Bangladesh Renal Association, Chattogram, Professor Dr. Pradip Kumar Datta, sir, to come on the dais and conclude this session.
Thank you, all the moderators. Honorable Vice Chancellor, BSMMU, Professor Konok Kanti Borua, the chief guest of this inauguration session, the special guest, Honorable Vice Chancellor, Sylhet Medical University, Professor Morshed Ahmed Chaudhary, my teacher and the teacher of many of the teachers, Professor Harun Rashid, Dr. Nazrul Islam, Secretary, Bangladesh Renal Association, and the new elected Secretary, Dr. Hadiujaman, Professor Eteshamul Haq, Vice President, Bangladesh Renal Association Chattogram Branch, Dr. Nurul Huda, Secretary, Bangladesh Chattogram Branch, and the teachers, my teachers and other nephrologists from home and abroad, other delegates, ladies and gentlemen, Shubho Shonda. আমি প্রথমে বাংলাদেশ রেনাল অ্যাসোসিয়েশনকে ধন্যবাদ জানাচ্ছি আমাদেরকে ঢাকার বাইরে ব্রাঞ্চ গঠন করার সুযোগ দেওয়ার জন্য, এবং যে কোনো ব্যাপারেই ওনারা এগিয়ে এসেছেন। আমি এখানে স্মরণ করছি প্রফেসর ডক্টর রফিকুল আলম, প্রেসিডেন্ট অফ বাংলাদেশ রেনাল অ্যাসোসিয়েশন। উনি সবসময় আমাদের হেল্প করেছেন। উনি বিশেষ কারণে উপস্থিত হতে পারেন না, উনি আগামীকাল উপস্থিত হবেন এবং আমাদের ক্লোজিং সেশনটা উনিই প্রিসাইড করবেন। আমাদের আগের প্রেসিডেন্ট এবং সেক্রেটারি যেভাবে আমাদেরকে বিভিন্ন সহযোগিতা দিয়ে হাত বাড়িয়ে দিয়েছেন, আমি আশা করি ডক্টর হাদিউজ্জামান সেটা রক্ষা করবে এবং সেটা চালিয়ে যাবে, যাতে আমরা তাদেরই একটা ব্রাঞ্চ হিসেবে আমাদের কার্যক্রম চালিয়ে যেতে পারি এবং বিভিন্ন নলেজ শেয়ার করতে পারি। আমি আরও ধন্যবাদ জানাচ্ছি বাংলাদেশের বিভিন্ন প্রান্ত থেকে যেসব নেফ্রোলজিস্ট আমাদের ডাকে সাড়া দিয়ে এত কষ্ট করে এখান থেকে এসেছেন, এই জন্য আমরা আপনাদের কাছে কৃতজ্ঞ। আমি চট্টগ্রাম রেনাল অ্যাসোসিয়েশন চট্টগ্রাম ব্রাঞ্চের পক্ষ থেকে সবাইকে শুভ সন্ধ্যা জানাচ্ছি। সবাই সুস্থ থাকুন এবং কামনা করছি, এবং আমাদের কালচার, এই নেক্সট কালচার প্রোগ্রাম উপভোগ করবেন, এই বলে আমি আমার বক্তব্য শেষ করছি। ধন্যবাদ সবাইকে। থ্যাংক ইউ ভেরি মাচ।
আমাদের এই মুহূর্তে কালচারাল প্রোগ্রাম